All right. All right, thank you guys for joining us on the Brave podcast. And we're going to be digging into a very hot topic, a very loaded conversation that could probably go for 3 hours or more, but we're going to condense it a little bit. But my friend Liesel is here, and I'm going to let her introduce herself. But if you've never been on the Brave podcast before, Brave stands for bold, redeemed, anointed, victorious, and eternal. And I believe that is how God created his daughters, and that's how he wants us to live it out. So we tackle some hard conversations with hope. We have conversations that matter. And I'm just really excited to have you on today because we're getting into a topic on body image and nutrition and diet culture and all of the things. But I would love for you to just tell us a little bit about yourself and how you got into this field.
Well, thank you for having me. My name is Liesel Maddox, and I am a registered dietitian nutritionist. Currently, I live in the beautiful state of Colorado with my husband and one dog right now. And I am fully in private practice as a dietitian, specializing in treating eating disorders, disordered eating, the body image struggles that come up with that, maybe some co-occurring health conditions that can come up alongside those things. And, the heart of my private practice is that I really love to get to integrate, Christian, Christ-centered, faith-based approaches into treatment, into sessions, as long as, a client wants to do that. But that really has been my heart, my passion, having come out of an eating disorder myself that started right around middle school. Became pretty severe, pretty significant, pretty quickly. Thankfully, I think truly just out of the grace of God, was able to connect with the right providers that knew eating disorders and started the recovery process, started treatment for that. Kind of late middle school and then on into early high school. And by that point, I was pretty determined that, okay, I want to get over this thing. Not, well, get through would be a better way to phrase it, but I want to recover from my eating disorder and had the support of a registered dietitian who knew eating disorders, a therapist who knew eating disorders, my pediatrician at the time, and then my parents and family. And thankfully, by late high school, and then once I went to college, I was fully recovered from my eating disorder. Now, that's not to say that I never struggled with disordered eating or body image struggles. But I had felt very clearly the Lord's calling on my heart as well that He wouldn't have brought me through all that if He wasn't also going to use the really hard parts of my story to help others. So I knew I wanted to be an eating disorders dietitian. I studied that in college, went on to do all the requirements to become a dietitian, and have been working with eating disorders ever since. And that's really the heart of not just my work, but the ministry that this is as well.
Yeah. You kind of touched on it a little bit. What is the difference for people listening between an eating disorder and disordered eating?
That is such an important question to cover. The shortest way that I like to phrase it is that all eating disorders involve disordered eating, but not all disordered eating becomes an eating disorder.
Mhm.
Disordered eating is any kind of just kind of non-normal interaction with food, with the way that we're eating. What makes this so tricky is that because we live in a society that has kind of trained us to think of dieting as healthy. I mean, so many people would think that those words are just kind of synonymous, that like eating healthy, being healthy involves dieting and restricting our food somehow, or, being maybe like overly obsessed with food in some ways, or exercise, or our weight, the number on the scale. And so disordered eating can resemble a lot of what we might think, quote, normal looks like when it comes to health and eating and dieting. But that could mean anything from going on frequent diets, skipping meals, obsessive like calorie counting or macro counting, cutting out entire food groups for very clear medical reasons that have been recommended by a provider. Um, Disordered eating can also involve a lot with exercise too. If someone is forcing themselves, pushing themselves out of that desire just to shrink their bodies, to lose weight, to change their bodies. And I know in athlete populations, that can be a really complicated thing to dissect because how do you know the difference between pushing yourself, forcing yourself to do some kind of exercise in service of a sport that you love and your performance versus when it crosses that line into, hey, this might be disordered.
Yeah.
Now, I will say to answer the second part of your question there with eating disorders, most people, probably first think of something like anorexia or maybe bulimia. But there's actually a whole range of different eating disorder diagnoses that involve behaviors like, okay, restricting food intake, uh, purging behaviors, whether that's making themselves throw up or using laxatives or diuretics, kind of like fasting or over exercise to compensate for something or how much someone ate, any kind of binge eating. Um, and then there's kind of some other more nuanced or specific eating disorder diagnoses. And these things can all overlap. Someone
Yeah.
doesn't have to just fit into the box of, anorexia versus bulimia. In fact, the most common eating disorder diagnosis is called other specified feeding and eating disorder. And it really is a description for when your behaviors are all kind of a mix of those things. And you may not be at a quote low body weight, but that does not invalidate the struggle that an eating disorder is, from the mental health side or the consequences and risks on the physical health side to the body, whether they've lost weight or they haven't, whether they're at a lower body weight or a higher body weight. I could go on and on about that, and I won't, but I think it is just important to recognize that disordered eating is still serious and still worth wanting to work on, wanting to heal, and especially for athletes, female athletes, your risk of disordered eating and eating disorders is already higher. So if you're noticing patterns of food, the way you think about food, this urge to like always eat less, lose weight, make my body smaller. That's already a warning sign right there. And that is, that's worthy and deserving of getting help, whether you have an eating disorder diagnosis or not.
Yeah. And yeah, it's so layered. And I think that's what makes it so complicated is, what do I have? What am I doing? What's extreme? What's just like, I feel like I'm being very nutritious. I'm doing this. And I think, I mean, you could probably speak into this very well. We're so misinformed because I feel like, let's say we start becoming very aware of our body very young, especially as we hit puberty and things start to change. And we're like, oh my gosh, like I just gained 10 pounds in a month because everything in my body changed and you're getting your period and all of that stuff. But where do they go? Like, I feel like they go to Instagram or they Google something or a friend says. And so if you were to like just guides like here's this young girl and she's trying to figure it out, where do they go? Like where do they go for the best information to understand how to keep my body healthy, how to train well, how to, be nutritious? That's probably not a reel on Instagram.
That is such a great point. Social media is one of the most dangerous, tricky places to get our nutrition information from because there's absolutely no one regulating, hey, like, is what you're learning on social media true? Is it coming from a professional that has, experience and education to speak to that? Or is it from someone who might actually be deep in their own eating disorder, putting content on social media? So if you have access to a sports dietitian, an athlete specialized registered dietitian, that would be amazing. Now I realize that that's not necessarily accessible for everybody. If someone, once someone's in college, there might be a sports dietitian on staff. You might also look in either in your local area or thanks to the telehealth world, we have more options for finding providers all over the United States that specialize in sports nutrition, as well as, there are people who have multiple specialties in sports and eating disorders. But trying to look for someone with credentials behind their name, probably in the same way that if you if you would kind of want your coach to have a background in the sport that they are coaching you in. Similarly, we want to look for professionals in the nutrition space that have the experience and expertise to really speak to that, but also to know you as an individual, because every single human body is so unique. So looking for registered dietitian, nutritionist is kind of the full title there. Now, the
Mhm.
tricky thing is anyone can call themselves a nutritionist. There's no like legal requirements or protection around that. My dog could call herself a nutritionist if she wanted to be,
Oh,
but to be a registered dietitian, it involves kind of the different schooling and exams and continuing education and clinical practice, just like, legally to call yourself a medical doctor, there's going to be some different requirements that go into that.
yeah.
Um, so that would be my top recommendation is look for a registered dietitian nutritionist, either in your local area, online that you can meet with, especially if you're trying to use like your health insurance or something like that to help cover costs of doing that.
Mhm.
And then if you have access to an athletics department and they have someone on staff, then
Yeah.
that is a really, really nice perk.
Yeah, yeah, I love that, and I think it takes some intentionality rather than just scrolling. But I mean, I think that's a big launching pad for a lot of ideas that are not not healthy at all. I kind of want to segue into the faith kind of component of understanding our bodies, and like I think it gets even more like, let's add another layer of complication that if you're a believer, you love Jesus, the knowledge is there, like right? I know I'm fearfully, wonderfully made. I know, but in the real world, you're acting very differently and you're having a hard time. I think there's almost like an extra layer of shame. I know better. I can't get through this. I literally can't like beat this demon, right? That has come up no matter how young. What do you say to a girl who is like she's a Christian, she knows better, the knowledge is there, but she's really like she's wrestling with this whole body image. Like what is she to do? Like where does she go?
My heart goes out to you if you're listening, and that describes the struggle that you're in on, number one, because I don't think that's God's heart for us. He doesn't, he never intended for us to wrestle with that kind of shame. And maybe for some people, they even describe it as like self-hatred or at least just like body,
Yeah.
body struggle, body image struggle, and how that spills over to what we're doing with food as well. And I think it really grieves his heart to see his daughters struggle in that way. So, number one, I would say there's just so much more that he has for us through his grace. There's so much freedom that he has for us when it comes to his good design for food and for our bodies.
Mm.
Um, a couple just truth-based encouragements that I would have for this person are that scripture does not tell us anything about how we should or should not eat, or if there are certain body weights, shapes, and sizes that are more honoring to God than others.
Mhm.
If anything, I think a lot of our culture seeps into the church and our church communities encouraging this, quote, like moral right and pure way of eating when we actually have so much freedom with food and with our bodies.
Yeah.
So I think as a starting place, I would encourage you to sit with the Lord and ask Him to help you identify, are there lies that I'm believing that don't match up with what Scripture says about food and the body that are coming more from culture, kind of like our diet obsessed culture, and are making the struggle harder for me.
Yeah.
One of my favorite resources that I will always recommend in this area is the book called Feed Yourself by Leslie Schilling, who is a Christian. She's a registered dietitian nutritionist. She also is a dietitian that has that dual specialty in eating disorders and sports nutrition. So as far as someone who is like super great to speak on this topic, it's Leslie.
Yeah.
So I would highly recommend her book, Feed Yourself, if that's something that people want to get started with, or especially for parents or coaches
Yeah.
I could not encourage that enough of getting your hands on that book. Um,
Yeah.
so that's two places to start.
Yeah.
Start
That's
by identifying, are these lies or are these truth about my body and food? And then resources like Feed Yourself by Leslie Schilling,
yeah.
to help start to uproot where you're believing things about your body or about food that don't align with God's heart. Um, but with all that being said, too, I would not be doing my job very well as an eating disorders dietitian to say that help is out there and help is so crucial to recovering from, a diagnosed eating disorder, yes, but even that disorder eating part, because I've seen plenty of clients where they never fully get help for the disordered eating, the body image struggle, because it doesn't feel, quote, bad enough, or they don't feel sick enough. So
Mhm.
they just accept that I guess I'm going to struggle and feel this way for a very long time. And not only does that impact our hearts and how we view ourselves as people made in the image of God, for an athlete, that's going to have a profound effect on your ability to show up and be fully present and fully engaged in sport and the performance side too, right? Because food is our body's only source of fuel. And if there's struggles around food, of course, that's going to then affect someone's performance.
Yeah.
So hopefully, if you're listening and that, you feel like you're struggling in this place, know that the earlier on you get help for an eating disorder slash disordered eating, the better long-term outcomes for full recovery from that.
Yeah.
Because unfortunately, it's not uncommon for people to struggle for decades of their lives with disordered eating or an eating disorder. Um, and I don't think that's what God's heart is for us when it comes to his really good and intentional design for the human body and for food as fuel, but also just for something that we're allowed to enjoy
Yeah.
too.
Yeah, I think we have a hard time enjoying food at that level. I want to so I want to backtrack a little bit. You touched a little bit, so two places on the church and, and how is it possible, and I'm sure it is, where the church possibly has played a role in how we view food and possibly have maybe lent a hand unintentionally with a diet culture. And you kind of said like that's more honorable to God. And then I would love for you to kind of go into what are some, whether it be a parent or just self-reflection, what are some early like identifying markers of like, maybe I need to course correct a little bit. So if you could do both of those things and just take us back to the church and then kind of be like, hey, these are some things to kind of watch out for, whether you're a parent or just you're self-examining your own way of like looking at things. So I would love for you to do that.
I know one way that I've seen diet culture sneak into the church in small ways, sometimes in really obvious ways, is the belief or even the teaching that there are some body sizes that indicate that we are more righteous and
Mm,
other body sizes that indicate that we must be struggling with something. So to be really specific, it's that idea that if someone is living in a larger body, they're at a higher weight, the assumption that they must be, quote, overeating or binge eating, and that's coming from a heart struggle of gluttony versus that if someone is living in a smaller body, a thinner body, that, well, they must not struggle with food. They must not struggle with, overeating, binge eating, the sin of gluttony. And
yeah.
yet the truth is that sin is something that starts in our hearts. And gluttony, for example, is ultimately a heart sin that, outwardly can be manifested with food, but also with other things outside of food. Um, and anyone of any body, weight, shape, or size can struggle with that sin. And at the same time, there are, I mean, hundreds of different reasons why someone's body may be predisposed to being at a higher weight and other bodies are going to be at a lower weight. I think
Mhm.
ultimately that really just reflects God's design for diversity throughout all of creation, whether that's the human body and our genetics, and the fact that if it's okay for us to all have different hair colors or be different heights, why would we expect our bodies to all, or that they should be all the same general size or weight? Um, so I think how that can kind of show up in the church in a harmful way is when maybe the person teaching or in our small group communities or in the Bible studies or, oh man, the diet plans out there, the weight loss plans where they slap a Bible verse on it and make it seem like this is the most righteous thing you should be pursuing to take care of your body, perpetuate this idea that it is more honorable to God to do everything within your control to lose weight or stay at a lower weight and prevent weight gain through how you're eating or how you're exercising. And I mean, I will say from personal experience, but also now getting to work in this field, that takes so much brain space and even spiritual energy to keep up with the diets, to keep up with the eating disorder. That is energy that we could be devoting to serving the Lord, getting to know Him better,
Mhm.
feeling equipped in what He's called us to do instead of being distracted by the food and body stuff. Um, so in terms of what we can do or, warning signs of this, something's not right here. If you or a loved one are starting to notice more and more obsession or, preoccupation with food, exercise, your body size, the number on the scale, or your clothing size, that can definitely be a warning sign that, your mind is starting to focus too much on food and body stuff. And then this kind of like double whammy effect happens when we are not fully nourishing and fully fueling our bodies with food, especially carbohydrates, because that is our body and the brain's number one fuel source. If your body and your brain are starting to get too little energy and they're being restricted, the way God designed our bodies and brains, we don't understand the difference between starvation from a diet, starvation from an eating disorder, starvation from I'm just cutting carbs, or starvation because someone has no access to food. So the body's going to respond the same either way. And one of the responses is that we actually start to fixate and think about food more
Mhm.
because it's part of God's way biologically and psychologically to try to get us to eat and meet our needs. So the double whammy that can happen there is you start thinking about fixating on food, weight, body more, and then you start restricting what you're eating through trying to cut calories, cut carbs, any kind of diet plan,
Yeah.
which then leads to some malnourishment in the brain. And then we think about food even more. So a number one warning sign I would give parents, coaches, athletes is pay attention to what are your thoughts doing. Does it feel like you're thinking about food and your body and your weight more and more than you used to? Because that could be a warning sign for sure.
Yeah, it's so good. And again, so complicated and just trying to navigate. And because I think we just see it everywhere. So it's not even like, and it's true, like we do celebrate, and I think intentionally very thin, certain types of bodies do get more appreciation. And so it's just a natural inclination, especially I think for a young girl to be like, oh, I want to be wanted. I want to be seen. I want to be beautiful. Like those aren't bad things. But they lend a hand to compromising everything that God has for you to please a world that just wants to destroy you, honestly. Like, we're trying to please the wrong thing and fit into a world that, it's not meant for us. So I love how you touched on that. I love just your whole site. And I love that you kind of say, like, go get real help. Go find somebody who really knows. Because I mean, if you want to get healthy, or maybe you are like, look, I would like to be, in a healthier body or at a healthier weight per se, go down the right road, because there is really great help, like people like you, who can really guide through that to get you to a place where you're healthy and not leaning into all of the things and bits and pieces that, so like when as soon as you said carbs, I'm like, yeah, the number one most hated food among women is your carb. So it's like they got a bad rap really early. But um as we kind of wind down, like, is your talking, what is something you so desperately want young girls to know? I mean, just through your own experience, if you could just plead with them, like what's something on your heart that you've either wrestled with, or you just want them to know so dearly because of what you've experienced and because you love Jesus, like what would that be?
Oh, the number one thing that comes to my mind is offering so much hope that our teenage years are so instrumental in kind of getting to decide how we want the rest of our life to go with our food and body story.
Mhm.
And that's not to say that someone can't work on healing with food or healing with their body image when they're older. But I meet with women all the time who are in their 40s, 50s, 60s, and beyond. And the number one thing they say is, I wish I had known this sooner. I wish I had not spent decades of my life struggling with disordered eating, going on diet after diet, obsessing about my weight, obsessing about food, missing out on the enjoyment of food because I've been so distracted by it this whole time. And I think, especially for young women, teenage years, college age, we have such an opportunity to get rooted in a healthy relationship with food, a healthy relationship with your body. And that will do wonders for the rest of your life to, one, actually promote better health long term. I mean, you will prevent health issues, both mental health and physical health, by prioritizing a healthy relationship with food and exercise and your body than going down that road of disordered eating and eating disorders. And just to get really serious here, because disordered eating is a really serious topic, eating disorders, they are the second most deadly mental illness of all diagnoses, second just to certain like drug use.
Mhm.
And so we're not talking about something that like, oh, it's not really that big of a deal. We're talking about something that um, people die from. And that's really scary. It's also really important to recognize like that's why caring about the risk and minimizing the risk is so important. And on a lighter note, one thing that is pretty cool is that we have research studies that show that people who have healthier relationships with food, even if, you're not going on these diets to, or especially because you're not going on these diets to constantly try to lose weight, they have better long-term health outcomes. They'll be more mobile, more active as you get older. Um, and I know that might be hard to see like the long-term motivation if you are, let's say you're in high school right now and you just want to think about what you can do for right now to help out your body. Um, Take it from someone who struggled with a significant eating disorder in middle school and early high school, that it will rob you of so much of your life and your thoughts and your energy. And this is such like a key developmental time that your mental, emotional, physical, and spiritual energy can be devoted to such bigger and better things than obsessing about food and obsessing about your body.
And so much more fulfilling, right? To get the energy and that you're off yourself and like go do things, that would fulfill you in so many other ways than whether or not you're eating carbs or not. So I appreciate you, Liesel. This was so good. And just, I know we could probably go, there's so many topics to like really dig into, but I'm gonna put your website in the show notes, and this, you have so many resources even without contacting anybody. You touch all topics, your blog, all of those things. So it's just a great starting point. I think if someone's kind of like, I don't know, like let's look into this more. So I'm gonna put that there, and just appreciate your time and your heart on this topic. It's not an easy one for sure to navigate, but my heart is that we just pump out the information that needs to be seen and kind of dilute the stuff that has really been detrimental. Not just, I mean, myself included, as I listen to you talk, I'm like, yeah, there's been some times where I have not done things really well. And looking back, you're like, yeah, that is all you obsess about. And like you think everybody else is obsessing about you too. And that's not the truth. So I appreciate you so much just being on here with us. And I'm excited to put this out there for the world and just hopefully be a really great resource for those who find you. So thank you so much.
Thank you for having me.
Absolutely.